Yes, there's been a lot of talk about mental health and the impact on mental health of people of all ages, but I think the older person has been impacted far more significantly than younger people. Age UK did a survey at the end of last year looking at the impact of COVID-19 on older people's physical and mental health. What they found was, in terms of anxiety, 1 in 3 people over the age of 65 had evidence of increased anxiety prior to pandemic. About 45% of people were worried about leaving their home for fear of catching the infection. Obviously, that hopefully will improve now that people have had their vaccinations and feel a bit more protected. In terms of low mood and depression, the proportion of over 70s with depression has doubled over the past year as a result of the COVID-19 pandemic. The thing about depression in older people is that it doesn't often present in the same way as in younger people. It often presents with multiple physical symptoms. And for example, I saw a lady a couple of months ago who in September or October had to have some fillings done on her teeth. About a week or 10 days later, she felt as though there was a piece sticking out, went back to her dentist who couldn't find anything wrong. This sensation continued to get worse, and by Christmas time last year, she felt as though there were nails sticking out of her tongue and her mouth. Again, had been to her GP and to the dentist, and they couldn't find anything. I saw her at the beginning of the year. In addition to this sensation she had a number of other symptoms in keeping with anxiety, and she was clearly very anxious and depressed, and the sensation was all related to her depression. And after talking to her and starting her on antidepressants, her symptoms resolved after about 4 or 5 weeks, and she's now back to normal. So depression is an important problem in older people, but often doesn't present in the typical way it presents in younger people. In addition to depression, obviously not being able to go out and being stuck in the house has led to a loss of confidence, and 2 out of 3 older people are afraid of using public transport, and 1 in 2 people at the time of the survey were afraid of going into hospital for fear of catching COVID and dying from it. So there's a lot of evidence about lack of confidence as well. And loneliness in older people has always been an issue, but with the isolation and the lack of socialization with family members and visiting and everything has made that a lot worse. It's important to note that for younger people and for people who are relatively wealthy, they have access to the internet and web-based services which they can use to see family members. But there are about 4 million people over the age of 65 who have no access to the internet. So loneliness is another significant issue in older people. So those are the aspects of mental health that have been impacted by COVID-19 pandemic. And it's how we deal with it in the future, which will be important both for younger people, but also for older people. Yes, I think with older people, when you have a lack of socialization, a lack of interaction with other people, they tend to just lose motivation to do things, and that impacts on physical health. We know that people who come into older people who come into hospital, if they're in bed for more than a few days, they become deconditioned. As a consequence of the pandemic, there has been a significant impact in older people's functional abilities. So again, the survey by Age UK showed that 1 in 4 people were less able to walk as far as they were before the pandemic. And 1 in 5 people feel unsteady on their feet. And obviously that has implications. If they're feeling unsteady, they're afraid of walking, so they do less walking and they become worse. There's also the fear of falling and causing significant injuries. So in terms of their basic physical functioning, their ability to walk and balance and everything has been impacted by the pandemic. 1 in 3 people reported that food preparation had become more difficult. And if that's the case, if they're not eating well, if they're not having a healthy, balanced diet, then they're more likely to have an impact on their physical functioning and also their mental functioning. So that's all very important in terms of the physical health of older people. And of course, the other thing that's happened is most older people have lots of long-term conditions such as heart failure, kidney problems. They may have had strokes and physical disabilities for which they would normally be under regular review and follow-up in hospital or by their GPs. None of that has happened over the past year or 18 months, which means that their long-term conditions have probably declined and have impacted them. And in the same study by age concern, 43% of people with long-term conditions were unable to walk as far as they were before the pandemic, compared to 13% of people without any long-term conditions. So there's been a significant impact on physical problems. The other issue with physical problems is that patients, older people, are often not able to vocalize their symptoms as well on the telephone, and it's often difficult for general practitioners to assess older people on a video consultation or a teleconsultation, which is now the preferred method for primary care. And as an example, I saw another lady who had been, she's 86, on her 85th birthday, she swam 85 lengths swim as a challenge to herself. She was a previous swimming instructor. She went out to her local shops in September last year when the lockdown was eased a little bit, and found that her left leg didn't work and she had a fall. She was seen by her general practice, by a telephone consultation by her GP, who arranged for her to have some grab rails and things, but didn't see her in person. She then, by October and November, she was finding it difficult to go upstairs because her left leg just wasn't moving well. By December, she couldn't use her left arm. And she then, I saw her in January when she had a claw hand on the left side, and she was unwell. And she, in fact, had a rare neurological condition which had been undiagnosed for about 8 or 9 months. Unfortunately, the condition doesn't have any treatments, but we can improve her quality of life by aids adaptations and putting her in touch with specialist societies who help people with that neurological condition. So there's the general impact on older people of physical illness, but also misdiagnosis and late interventions, which then mean it's much more difficult for older people to manage by themselves and to maintain their independence. So I think if we think in terms of most older people's services, they were pared down because most of those departments were busy dealing with COVID-19 acute emergencies and things like that. Most older people's services are now starting to slowly get back to normal. However, there is a big backlog of work that needs to be done. And for most specialists in older people, a lot of focus is still on dealing with inpatients and the acute emergencies. So the patient work and the elective work is still a lower priority, but hopefully that will improve. Excuse me. But it may take another year or 18 months before services are back to normal, assuming we don't have any further peaks in the pandemic. There is a lot of evidence, and this evidence base has increased over the last 10 years, which demonstrates that physical and mental health, not only of younger people, but of older people, is very closely linked. And so in order to maintain physical and mental health, the important things are socialization, making sure they have a circle of friends or social group with which they can meet, ensuring that they remain as physically active as possible, perhaps joining groups and classes for exercise, which would improve their physical abilities and also help their mental health. Having good nutrition is also important. The key bit about nutrition is making sure there's enough protein and vitamins in their diet. A lot of older people tend to rely on cakes and biscuits and toast and tea, which will give them the calories, but is tending to not build up their muscle mass, which they tend to lose fairly quickly. So it's important to have a healthy, balanced diet as well.